I go crossing there to the doctor just for I'm just in shock.
Yeah.
So I just want to hear.
Yeah, absolutely.
Just wanted to clarify the blood work. The blood sample they took last Friday, they're still waiting on a second cancer marker from that blood work. The first one, we don't really have the results.
Was this the CA19? Do y'all remember hearing that word? That may be the word that they're
tumor
talking, a tumor marker.
Marker, that's what they call
So
it.
the CA19 is a protein that we all have detectable to some level in our blood. If it's high and you have a pancreatic tumor, it's because it's coming from the pancreatic tumor.
Okay.
So I did get that one back. Your level was elevated. It was 193. So that's just consistent with the diagnosis.
Okay.
We already knew you had pancreatic cancer. Now that kind of lets us have a benchmark to compare to in the future how it changes with the treatment, so we can talk about what you need for this cancer. So you're still in the phase where we've got to figure out the staging of this, okay? If those lymph nodes aren't involved and that tumor is about 3 centimeters, which is what it measured on the endoscopic ultrasound, then this is a stage 1B pancreatic cancer, okay? If those lymph nodes are involved, then it's a stage 3 pancreatic cancer. The bigger, more important thing for pancreatic cancer isn't so much staging, is it resectable or not? Meaning, can it be removed by surgery?
The Whipple
can't it?
surgery?
You're right.
Yes.
Whipple is the one that we do when the pancreatic cancer is in the front of the pancreas, like yours is. So that's the big kind of deciding factor. Right now it looks that main tumor looks to be resectable. The question then becomes, are the lymph nodes involved? The lymph nodes will be able to be looked at with the PET scan. If they're bright on the PET scan, that's going to be consistent with the cancer having moved to those lymph nodes. So what do we do for resectable pancreas cancer? Well, if it's early, stage 1, a lot of times we'll just go ahead and go to surgery. If there's question or confirmation that the lymph nodes are involved or that tumor is larger, we'll do chemotherapy before surgery. Now, whether that, and let's go back to this early stage, if you go straight to surgery, we would recommend chemotherapy afterwards to improve the chance that you're cured of it.
Yes.
So we're looking at chemotherapy one way or the other. Cured? Yeah, that's what we'll be going for. Pancreas cancer's tough. I'm sure you've read about it. It likes to come back no matter what stage we're at. But what we're hopeful for is that you're in a situation where it can still be cured, okay? And that's the PET scan is going to be important for that. And then your response to treatment is going to be important for that. So what I would do right now, since there is real concern that those lymph nodes could be involved, and we've seen that tumor looks to be that it got slightly bigger over the course of November to later November.
November 7th to November 21st.
Yeah, it was 22 millimeters on a CT scan you had. It was 30 millimeters on that endoscopic ultrasound. You know, there is going to be some variation. Those are two totally different tests to measure things, but it very likely got a little bit bigger in that time. So what would we do? I would recommend we plan to start chemotherapy before surgery. Now, if you get that PET scan, the lymph nodes are clear, they look like they're not involved. Dr. Heslin and I discussed after that PET scan, and he's okay with proceeding with surgery. I'd be all for going to surgery without completing our standard course of chemo before surgery.
And my PET scan is scheduled for
January 7th. So that's pretty close. I'm going to go ahead and start the approval process for the chemotherapy, and we're going to talk about that, specifically what that means and all, just so that it's in place either way we go, okay? And go about it that way, okay? The reason, if you had come 6 or 9 months ago, we would have given you chemotherapy for 2 to 3 months prior to surgery, regardless of the size. Well, about 6 or 8 weeks ago, a trial came out that looked at early stage pancreas cancer, and were people benefiting like we thought they were from doing chemotherapy for those 2 or 3 months before surgery. Initial trials had suggested there was benefit, and there is for more advanced disease, but the earlier ones in this newer trial, they didn't seem like there was a benefit to doing chemo up front. Now there is still benefit to doing chemo after. So that's the question, and the lymph nodes is the deciding factor. We got to just see
One
the
thing
PET scan.
Dr. Heslin said, which I thought was, I mean, I'm skinny, I'm very skinny. So he was showing us that scan, and he said, you're so thin, and there's no fat
Right.
anywhere, not
Right.
even around my organs, that might have made those look a little bigger.
Mhm.
I don't know.
Yeah.
Y'all the experts, but so if I'm hearing you right, we're gonna get the approval,
Mhm.
but we're not gonna start chemo right away.
Today is the 17th. We could definitely start it before the PET scan. I'm going to talk with Dr. Heslin and see how concerned he is about the lymph nodes. I'm okay with waiting until just after the PET scan. If he's okay with proceeding with surgery pending that scan, then that's fine, and we'll do chemo after. If we're not sure about the lymph nodes, your CA19-9 level is elevated. I would be okay with doing the chemo before. You're going to get the same amount either way.
Right.
It's whether you do 3 months before and 3 months after, or just all 6 months after.
So
Okay.
does this mean this nano may not have to have anything done before Christmas like that?
Yeah. I think
mean,
that's a reasonable.
I'm not asking that. I
Oh, yeah,
wanna do
before
what
Christmas.
you
Yeah,
want
absolutely,
to do.
before Christmas.
I want to do
Yeah.
what you say.
Yeah, absolutely. We're not gonna, start anything before Christmas.
Okay.
I kind of forget how close we are to Christmas.
A week.
It's a week, yeah.
Couple-
I'm not in any severe pain.
Yeah.
I only have pain if I eat too fast, by the end of the night, and it's not severe. It's not, I mean, I took one Advil last night,
Yeah.
and it's, kind of round in here, and it's, if I eat past a certain time, I
Yeah.
just do not do that. And I'm not nauseated,
Mhm.
I don't feel sick.
Mhm.
I really don't feel sick.
That's great.
But I've seen the pain increase from just discomfort to a little more than just
Mhm.
discomfort. I mean, like last
Yeah,
night. it
last night
a
was-
little
And where are
worse.
you hurting?
It's in here,
Kinda right in
around my
front, the back,
back, yeah, I'll feel it, but it's not severe. I mean,
Have you lost any weight?
okay, now I did lose weight, but let me explain my weight loss. I'm a fanatic. And when I went to my doctor on October 31st, I knew my body.
Mm-hmm.
And honest to goodness, this sounds so blessed, I never have pain. I don't have back pain, joint, I don't have any pain.
Mm-hmm.
So when I started, it wasn't pain, it was like weird around my waist, like at night, my clothes just didn't feel comfortable on me. And so I went to the doctor, and they did the blood work. They thought it was my gallbladder, which it wasn't. And before we had my PET scan, my levels in my pancreas, the enzymes were up.
CT scan.
Yeah, so we're thinking pancreatitis. So I went online and said, what do you do for pancreatitis? Broth. I mean, when you tell me to cut something out, I cut everything out of my diet. All fat, I mean, I didn't eat anything.
Okay, so you may have lost some weight
I
from changing
lost
the diet.
from that. I changed my diet so dramatically.
Prior to that, in the couple months before, your weight had been stable?
Yes.
Okay.
I
All right.
always weigh about 106 pounds. That's
Okay.
my normal weight.
All right. While we're talking about that, this is a cancer of a digestive organ,
I know.
so it's going to impair your ability to digest fat and other nutrients. So what we often use in folks with pancreas cancer is a supplement that replaces the enzymes that would normally secrete and help you digest your fat. That medicine is called Creon. It's some capsules that I'll have you take with your meals that will
Okay.
help the digestion. It can help with pain too, and maybe help the weight stay a little more steady. Okay, so I'll write for that today. If you go to fill it and they tell you some crazy cost to it, don't fill it, and let us know. We can see what other options we have there.
Okay.
Usually it's your insurance covers it fine, but
I
every
have
now and then somebody
Tricare
tells
for
me
life.
something
It's pretty
crazy.
much.
Yeah, I just want to tell you, like, don't feel like you have to go, if they tell you like $800 or something, don't do that. It's not that important right now, okay?
No, I'm not.
Um,
I'm a retired accountant, you don't have to worry about
yeah,
that.
I got you.
So,
Um,
can I ask a question?
Yeah, please.
Yes.
The second marker from the blood work, when can we expect that?
I think that what they were referring to is something called the CEA, or carcinoembryonic antigen. It's another tumor marker. It's more associated with colon cancer. It was mildly elevated. That does not mean you have colon cancer. That it's elevated because of the pancreas. There's some overlap
So
between
he
that.
said they've already got it back. So
If that's the two they're talking
Yes.
about, I suspect it is CA19 and the CEA that was
Okay.
was back. The CA19 is the most helpful, in this situation. Okay, so the chemotherapy that we'll use, whether it's before or after, we'll use what's called a chemoport to give this. You've heard of ports before.
I'm gonna show you this. My little mother gave me this.
Uh-huh.
And I wore it today. This makes me cry. The last time I was here, I came here in 2012 with my mama.
Oh.
She battled cancer, so today's emotional for me. My mother battled cancer for many, many years, and to the point, she called him Big John. That was her doctor.
Dr. Reardon?
Yes, and my mom was a mess. He was Big John.
He's still, I think he's been called Big John most of his life.
And,
He's been around a while.
I came with her a lot, but I came that particular day when they told her that she had breast cancer, it was gone to her liver, and that the chemo was no longer working. So, and she died of chemotherapy. So today,
hard.
besides me,
Yeah,
I'm emotional about that.
I understand. That's
Love
just
your mama.
intensity of those
Always
things.
be with us.
All right, we'll come back to the port. Since
Okay.
you talked about your mother's history, let's go with that. You need gene testing to make sure nothing's running in the family that puts you at risk of pancreas cancer, regardless of your mom's history of breast cancer, but even more so in that setting. It's just a blood test. It will require us to poke you again. We can go ahead and do it today, but we don't have to run it
Can
today.
you do
if
it
you
on
don't
the
want
other
to.
one?
Yeah, they can.
This
And if you want to wait until you come back and have to have labs for other reasons, we can. It's not going to change any treatment right now, but it is something that we could go ahead and have that information earlier.
What do you want me to do?
So if you want to get poked again, I'd do it. I mean, if
Do
you
it
are
today.
okay with getting poked again, I would go ahead and do it today.
You're gonna have to learn another term for that
If you
besides
want
being
to.
poked again. Okay.
All right. Well, now
Yeah,
talking
we'll
about
just go ahead and
pokes.
do it while we're here. Oh.
Talking about pokes.
Yes.
Now that's a good segue back to the port. That is one big poke to save a lot of smaller ones
Yes.
with the IVs. Okay, so that is an outpatient minor surgical procedure. You don't have to get put to sleep. What they do is numb the skin right here below your collarbone, usually on the right. They'll make a shallow incision about the length of that blue part right there. They'll tuck a port, which is a little rubber plastic bulb under the skin. There will be a catheter tube about that big running from it under the skin over the collarbone and hanging into this vein right here securely in the neck. They'll close that skin with some special skin glue. There's generally no stitches or anything like that.
And they don't put me to sleep.
You won't have to get put to sleep. Yeah.
I've never been put to sleep until
Yeah.
I had the scope.
Yeah. Now you're going to be sore around it for a few days after, but it'll heal up and you'll just have this kind of lump about that big under the skin there.
Okay.
The nurses will be able to access that port with a small needle. They can draw labs, give treatments, whatever we need to through that, so you don't have to get an IV each
Yeah,
time.
I would
Okay.
like to have that.
Yeah,
for sure.
and the chemotherapy that we'll be talking about, in your case, we have to have it because then let's talk about the chemos. There's a couple different options of chemotherapy regimens. The most effective one, the most aggressive and most effective, is a regimen called FOLFIRINOX. That's a combination of 3 chemotherapies and a vitamin called leucovorin. So that's an acronym, FOLFIRINOX. The beginning, the FOL is short for fluorouracil. That chemotherapy has to be given through a pump. So you'll have this port accessed, you'll have a little tube running under your shirt, going to a little pump, a little bit bigger than an iPhone case down here. And so if you started on a Monday, you'd get that connected. It would give you an infusion over 46 hours. You would come back 2 days later, a Wednesday, you would have the port de-accessed, meaning the needle taken off, the pump removed from attached to your waist. You would be at home with the infusion over 46 hours. Yeah, there's nothing you need to do. Just let it run. And we would do that every 2 weeks, okay? So we have to have that pump to be able to do that infusion, all right?
The port.
Yeah,
Okay.
I'm sorry, the port we have to have for the
I will
infusion.
tell y'all this, I don't know if it's because I'm very small, but any kind of medication, if you take 2 Advil, I never need but 1.
Yeah.
It
So
affects my body like that.
So this is all weight based.
Okay, good.
It's based on something called your body surface area. So it's going to be adjusted to your size. So that's one of the chemotherapies, the fluorouracil. The vitamin leucovorin, it's given to help the fluorouracil work better. Then the other 2 drugs in this regimen, the Erie part of FOLFIRINOX, that stands for irinotecan. That's a chemotherapy that's going to go through the port as well, but it will be given only that day on Monday. Your next dose will be 2 weeks later when you come back for the next
Oh, so this
cycle.
is something I would have in addition. I have that first, and then back to that pump then.
Yep.
Okay.
Yep. So the irinotecan, another chemotherapy that helps to kill the cancer cells, its big side effect is diarrhea, okay? Some people don't have an issue with it. If you do, it's usually pretty well managed. We can just give you some antidiarrheals. It's not typically a major problem. Then
I lose this glory right here.
we will have, we may not have complete hair loss, but we'll have some thinning, okay? It will come back once you're done, okay? The oxaliplatin, that's the ox in FOLFIRINOX, that is another IV chemotherapy you would get on the same day, okay? Its big side effect is it can cause tingling or burning in the fingers and toes, and the more of it you get. And we don't expect that earlier on, but we'll have to be mindful and ask you, frequently how your fingers and toes feel. It can make your mouth feel funny if you drink something cold that day of your treatment, so don't drink any ice water or iced tea, just room temperature liquids.
They'll tell me all this later.
Yeah, you're gonna hear it all again. When you come back, you'll have what's called patient education to discuss these drugs again downstairs with one of the nurse educators to go over all this, and I've got some information on the drugs you can read over as well. The main side effects, or the most common side effect to chemotherapy is fatigue, all right? It's gonna make you feel more tired than you normally would, and there's really not a good way to avoid that other than get plenty of rest, try to have some physical activity, walking each day, trying to eat well and maintain your weight. So we'll try to combat it that way. It will cause low blood counts. That can put you at risk of bleeding or infection, so we have to check your blood work every 2 weeks before these treatments to make sure it's in a safe range. There may be times that we have to delay or adjust a treatment based on the blood counts. That's mostly it. There can be all kinds of different things. You might cause some dehydration. You might have a rash. There's other things we can experience that we'll just have to watch for, and you let us know if you experience those. While we talked about infection, we will ask that you call us if you have a fever on treatment, because that can be a sign that you've got a bacterial infection, and we will have some antibiotics that we may tell you to take at home. Most people that have a fever on chemotherapy are not infected. It's just the normal response to the cancer and the chemotherapy. So let's get this approval process started. I'm going to talk with Dr. Heslin now that I've met you, and then we will see about the timing of the chemotherapy. Okay?
I don't even
But it's
know
not going to be
what
before Christmas.
I have a lot of baking to do.
So the timing for the chemotherapy to begin, with the PET scan on January the 6th or 7th?
7th.
So,
January the 7th. are you thinking it's gonna be prior to that, or maybe?
Let me talk
later?
with Dr. Hesel and see how concerned he is. I would be okay with it, based on the CA 19.9 being a little bit elevated, and seeing the growth over the 3 weeks. I want
You're
to make
leaning toward pancreatic. Is that what you're saying in that, seeing those? It is pancreatic cancer,
it is
right?
pancreatic cancer.
Okay, that's
Yes.
what I never would have been actually told that.
Yes, it is pancreatic cancer. Yes, ma'am.
Okay. Which is the hardest too. Also, it comes back. It wants to come back, doesn't it? Because I've got a dear friend right now.
Yeah.
His is back. He had the Whipple surgery in 2021, and his is back now.
Well, that's actually pretty decent.
That's what
Time,
Dr.
2021, yeah.
Wilson said.
Yeah. Yes, I'm leaning towards starting earlier. I want to make sure Dr. Heslin's okay with that, because giving chemotherapy affects surgery timing. We generally don't go right into surgery, a week after chemo, because that can increase the bleeding risk and infection risk and things like that. So let's just get things set up as if we can go ahead and start, first of the year. And then we can adjust that based on the PET scan and surgery plans, okay?
Would starting chemo ahead of the PET scan, would that affect moving the PET scan to a different date? No, you can just
No,
continue.
and I don't think it would affect the results of the PET scan either. I think if you've got lymph node involvement with your pancreas cancer, one cycle of chemo before it is not gonna make those lymph nodes go
And the
away.
only way we can tell if it's in the lymph nodes is through the PET scan.
That's the best way, yeah.
Why do you have to wait so long to get the PET scans? Is it just because there's so? I am overwhelmed when I came in here, my heart, for all
Yeah.
the people in here and how many people.
Yeah.
I mean, your place is full.
Not everyone here has cancer though.
Okay.
Yeah.
Okay.
Probably half don't.
Half of them
Yeah,
don't.
we do something else called hematology here too, so.
Oh, okay. My goodness, okay.
All right, but that does allow us some time to get the port placed. Now, Dr. Heslin can place ports, but it might be more convenient for you if we do it here in Montgomery, less driving.
If you feel comfortable.
Oh yeah, we
Wherever
do it all the
y'all-
time, yeah.
I hope
They'll
so.
do this at the radiology department at
Oh,
either
here.
Baptist South or Baptist
Oh,
East.
okay.
If you have a surgeon that you know of, well, down in Luverne, there's a Charles Tompkins, I
Yes,
think.
Dr. Tompkins.
Yeah, he
Mhm.
does ports if you know him, and I bet he could probably get you in pretty quick to do it too.
He does them in Laverne?
No, I don't know. If
We've,
he does it in
we've
Luverne.
never
I think you
done
might do it in
never used-
Andalusia.
I've never used Dr. Tompkins.
Okay.
We didn't use
It doesn't
them when we
matter.
first moved there because they did not accept our insurance.
Okay, we'll just do it at the radiology. It's not far.
Okay.
What's it, like an hour for y'all
Oh, yeah,
here?
that's not, we
Yeah.
come up here
We'll
all
just
the
do it here.
time to buy groceries and things. So I'm gonna get some kind of medicine to start taking when I eat my meals.
Yep, I'm gonna go ahead and call in some Creon. You're gonna take, the way I tell people to do it is take a couple capsules before you sit down. When you sit down to eat, a quarter of your meal, take the remainder of it, and then finish your meal. That kind of mimics what your pancreas would do with the enzymes.
Okay.
You want me to send that to which pharmacy?
Crenshaw Drugs in
Crenshaw
Laverne.
Drugs. We will do that.
Let's see if I got their number.
No, you don't need to.
Yeah, Look, I'm gonna try to be a good patient. I'm very, I'm seeing what my mother went through with his mother. I'm a little stressed about it, I'm gonna be honest. But I do have faith in God. And I know this will be for His glory. And it'll be for somebody's good.
Yeah.
Possibly a lot for me too.
Well, you go home and enjoy your Christmas with your family and all. We'll get this set up. You'll be contacted about the port scheduling, and Amanda is going to set you up for the patient education for the drugs. We may go ahead and do that and just not start it. Just have you do the patient education, and then that
Okay.
way
I'll be
everything's
ready
set.
to go.
Elizabeth's going to come in here in a minute and ask you a couple questions about this gene test we're going to send off today.
Okay.
And on your way out, you're going to go by the lab on the first floor to collect the gene test, okay?
Okay. Well, let me give you are you through with it?
Yeah, I think so. We're going to be, if we have any more questions, I'll have another opportunity to.
You did a
Thank you,
good
Doctor.
Pleasure to meet y'all.
Nana.
Good to meet you.
I'm Nana.
Nice to meet you, sir.
Nice to
Thank
meet
y'all,
you.
nice
All right.
to meet you.
Could you just want some napkin? I got one.
Oh, okay.